Now, it's just come up to 7:25. Good morning, it's Breakfast with Lee Benyon on BBC Radio Merseyside. It was one of the worst hospital trusts in the country in terms of controlling infections like C. difficile and norovirus, but the Royal and Broad Green Trust in Liverpool has had a complete turnaround. Today, it becomes the world's first international centre of excellence for dealing with bugs and germs, after using a new kind of technology to stop the spread of infections. And our reporter, Sam Clack, is at the Royal now. Sam. Oh, no, I beg your pardon. We can actually speak to the Director of Nursing and Operations who leads the infection control at the hospital, Diane Wake. Hi, hello, Diane. Thanks for speaking to us this morning.
Good morning, Lee. Thank you for inviting us to speak this morning.
That's all right. What have you done to change things then?
We've done a variety of things, and I think that we're really proud to be awarded this status of being a centre of excellence, but it is down to our clinical and non-clinical teams in the Royal and the contribution that they've made in terms of the reduction around healthcare-associated infection. The use of the technology really has been the icing on the cake in terms of it enhancing our cleaning regime within the organisation. And we first got to know about the use of HPV technology when we were fortunate enough to do a trip to Baltimore to Johns Hopkins Hospital, where they were using HPV to enhance their cleaning within the Johns Hopkins Hospital. And that was something that we were really interested in. So back in 2008, when we came back from that visit, we decided to use some of the things that we'd found there and implemented them within the Royal. And the use of hydrogen peroxide vapour to enhance our cleaning regimes was something that we put in place.
And so what impact does it have on does it increase the number of people you can actually treat at the hospital?
It doesn't increase the number of people that we can treat, but what it does do is it enhances cleaning. And I think there's no one solution to cleaning, one complete solution. And for us, we've modified our cleaning regimes. We've worked very closely with our hotel services team and our contractor, ISS, and we had some fantastic cleaning regimes in place. But what we felt the hydrogen peroxide vapour did was really get to the nooks and crannies in bays and within side rooms where you can often see where pathogens are lurking, and you can't often see it, and that's where the HPV mist gets to the place that you can't actually see. And what we did is all of the interventions that we put in place in the Royal, which was around changing the culture, making infection prevention everyone's business within the organisation, having a real strong commitment from our staff and our clinical teams to reducing the burden of hospital-acquired infection. We plotted that to look at where we've had the biggest impact. And we could certainly see that where we put in place the HPV system, that we saw a massive reduction in our rates of C. diff and norovirus. And certainly since 2008, we've seen a 91% reduction in rates of Clostridium difficile and norovirus within the trust, and a 89% reduction in our rates of MRSA.
So they're huge reductions, but I suppose you're never going to eradicate it 100%, are you, or are you?
Well, we're striving to, and that's our mission. We're on a journey, and we've always said that, and our journey is to zero, because our culture is about patient safety, and we want to reduce any harm that we cause to patients. And any patient, in our view, that acquires a hospital-acquired infection, we deem that as we failed that patient. So our target is zero, and that's what we're striving to do. And certainly this year we've seen our lowest rates ever.
So why is it so difficult to keep hospitals clean then? It's like it seems that we never used to hear about these infections years ago. It seems to be a relatively modern thing.
I think it's just because we monitor these things so very closely, and I think that's something that the NHS is very good at, that we provide a lot of data, and that data is analysed, and I think we're very unique to other healthcare systems, both in Europe and within the United States. So we just monitor it very closely, and I think it is about getting the right cleaning system in place and making sure that you're not compromising patients by not cleaning rooms and bays adequately. And we've got a really strong ethos here in terms of that cleaning is vitally important. Yes, we need to move patients through the hospital and ensure that there's no delays to their treatment. And the systems that we've got in place doesn't delay patient treatment at all. It's just a fantastic cleaning system that has really contributed to reductions in healthcare-associated infection.
And do people who come and visit and people coming into the hospital still have a responsibility to make sure, that they don't bring infections in with them? So presumably still, wash your hands with that alcohol cleaner before you go onto a ward and so on?
Absolutely. We've got alcohol hand gel at all key points within our hospital, and certainly our isolation ward and infectious diseases unit. We have sinks at the beginning of the ward so that patients and visitors can wash their hands. And again, we would ask that visitors don't bring children or themselves into our hospital if they are ill, particularly with illnesses such as diarrhoea and vomiting, because organisms like that spread rapidly, particularly through a hospital environment. So it is everybody's commitment towards reducing healthcare-associated infection.
Well done. It's good news. Thank you very much for speaking to us this morning. That's Diane Wake, who's the Director of Nursing and Operations at Broad Green, the Royal and Broad Green Hospital Trust in Liverpool.